We are all aware of how exhausted people are about the changes in their lives over the last 2 years. And the numbers speak for themselves when we say that it is estimated that between 60 and 80% of the EU population have now had COVID. We are entering, however, a new phase of the pandemic, and a new phase that requires us to rethink of how we manage this virus. And this is why we are today presenting a new approach and are setting out actions that help us to look ahead and move from an emergency to a more sustainable management of the pandemic. So instead of mass testing, we shift the focus to most representative cases and obtaining reliable information of the intensity of the transmission. So what we're asking of Member States is to be able to continue to follow and be able to look if there are any changes in the severity and the transmission of the virus. And that is why we're inviting them to have integrated surveillance systems all the year round, looking at all respiratory illnesses and not only COVID-19. When it comes to vaccination, we need to push forward with our efforts with the booster campaigns. Boosters are currently plateauing at about 64% of the adult population, and we still have 90 million European citizens who are unvaccinated. We were continuing to work with research and manufacturers to develop a variant-proof vaccine, which will offer us a longer protection against infection. But in the meantime, we need to continue with vaccination programs. On our side, we'll be working on a strategy for the next generation of vaccines. And I also want to tell you that we launched a process to secure the manufacturing capacities for vaccines in Europe under EU FAB, with a view to have suitable vaccines available at any time needed.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.